Welcome back, everyone. It's 2:55, and yours truly is here, still with you, to introduce our next presenter. Arick Combs is here to present Caring for Veterans with Dementia, the importance of early detection and care coordination. I'd like to just tell you a little bit about Arick before I turn it over to him. Arick is a New York State licensed clinical social worker and certified dementia provider who has worked for Canandaigua VA for the past 4 years and is now the dementia care coordinator for the Finger Lakes VA healthcare system. He is responsible for creating the Cognitive Care Clinic program, which helps veterans who begin to experience early cognitive impairment warning signs through the process of getting an accurate diagnosis. For those veterans who have been diagnosed with dementia, the program offers support and coordination of VA and community services to help them achieve their goals. Arick, thank you for being with us, and you can take it away when you're ready.
All right, Tara, thank you so much, and thank you for inviting me. It really is an honor to be here to present this information. So I am the dementia care coordinator for the VA. I work mostly out of Canandaigua, but I also do provide services out of Bath and Rochester. And so while mostly what we talk about today is going to be about veterans, there's a lot of information that can apply to the general public as well. But for those of you who may work with veterans or have veterans that you're aware of, there's a lot of really good information about how to get them connected with services. So I wanted to give an outline about what I will be talking about. First of all, we're going to talk about the dementia effects on the military population and their families. Then we're going to learn how to recognize cognitive impairment in dementia warning signs and the benefits associated with early detection. I can't stress that enough. Early detection is so very important to cognitive impairments and dementia. Then we're going to discuss the importance of care coordination and how it can benefit those with a diagnosis of dementia. Not only for the veteran, but also for the caregivers and the families. Then we're going to learn about services and benefits offered by the Veterans Administration, specifically for veterans with a diagnosis of dementia, but a lot of those services also pertain to the family and caregivers as well. So that's what we're going to talk about. So first, dementia and veterans, we're going to talk a little bit about statistics, veterans as an at-risk population, and some of the unique challenges that face veterans and families. So these are some New York State veteran statistics. So in New York, there's a total of 747,000 veterans. 548,000 of them are wartime veterans. 198,000 are peacetime veterans. There's roughly 64,000 female and 682,000 males. Percentage of the overall New York population that are veterans, the information I got was 3.7, but that statistic also said there was only 580 veterans in New York. So that number may be a little bit higher. But the percentage of veterans in rural areas is pretty steady at about 27%. So well over a quarter of those veterans in the rural area. And that's what we're reaching out to. Some dementia specific statistics, and this comes from the VA itself. Back in 2019, 2020, 2021, and 22, the VA began to look at dementia with some significance, and they started doing a lot more research and developing programs. The dementia care coordinator position was created back then. And they've wanted to grow this program, which is what's happening now. So the information mostly comes from 2022, but they did offer a lot of projections for 2033. So it's a ways out. But they estimated that the total number of US veterans with dementia to be 735,000. And in 2023, they estimate a 2.4% increase, which is kind of on par with the general public. One of the interesting things when I was looking at this statistic, though, is that if you look at current or the past year or two, the percentage of people with dementia has actually gone down. But I do think a lot of that has to do with COVID. I think when a lot of things shut down, veterans started isolating a lot, and they stopped reaching out to healthcare. So I don't necessarily think that it's decreased much as the statistics say, but I do think that veterans are reaching out more now, and that's where that increase is going to come from. They can now reach back out to start getting some care. I know here at the VA, we have just started, well, we haven't just started, but maybe over the last year or so, we've started to get back to normal. So we're seeing veterans face to face. We're providing a lot of services. Some services haven't restarted yet, but we're in that process. The most interesting statistic, though, is that only 406,000 of those 735,000 are enrolled in the VA. So this leaves 55% of the veterans with dementia not receiving VA health care. It's a pretty significant number. But the projected number of veterans with dementia being enrolled in VA healthcare is expected to increase by 21.2% by 2033. And this is where we need to be prepared and have the services in place for those veterans as they start coming, and I believe that they will. So veterans as an at-risk population, there's a lot of different things that veterans are exposed to that lead to or can lead to dementia. One of them is traumatic brain injuries. Between 2000 and 2019, there's been an estimated 414,000 veterans who are diagnosed with a traumatic brain injury. And TBIs increase the risk of developing dementia by 60%. Another complication is PTSD. Veterans are 4 times more likely to develop post-traumatic stress disorder as compared to civilians. Research shows that PTSD is associated with a greater risk of developing dementia. Veterans are exposed to traumatic situations by virtue of their job, and quite often at earlier ages. And trauma in earlier life is a risk factor for developing later life dementia. So veterans who have also been deployed have a higher prevalence of memory problems. Being deployed as a veteran comes with a whole lot of stressors and a whole lot of situations. And memory problems have been shown to happen when veterans are deployed. Veterans can have exposures to chemicals, and that puts them at risk for developing dementia. One of the most common ones that most people have heard of has been the exposure to Agent Orange in Vietnam. That can lead to Parkinson's, which can lead to dementia. There's been all kinds of things that can happen. Also in the Gulf War, exposure to toxic chemicals. We're starting to find that some of those chemical exposures are leading to different things, including early development of dementia. Previous presenters have talked about how hearing loss is associated with dementia. Hearing disorders from blast explosions, TBIs, and hazardous noise exposures are common among veterans, which also puts them at risk for developing cognitive impairments. Sleep fragmentation is also a known risk factor of developing dementia, and veterans have that. They have significant sleep fragmentation. Quite often they have to sleep short periods, which puts them 50% more likely to be at risk for developing dementia. So there's a lot of at-risk features for veterans. Some of the unique challenges for veterans with dementia. There can be a negative synergistic effect for veterans who have PTSD and dementia. PTSD can lead to the development of dementia, but also dementia can exacerbate the PTSD. So significant loss of memory, excessive confusion, behavioral changes, they kind of go hand in hand, and they kind of keep each of those active. So that's a unique challenge to the veteran population. Veterans with PTSD and dementia also have difficulties expressing their emotions or their needs, making it a challenge for caregivers to provide support and comfort. Having worked with veterans as long as I have, and also being a veteran myself, I do know that there's three things that characteristically veterans struggle with, and it's loss of control, it's lack of respect, and difficulty trusting. We run across that all the time, and those are things that are really exacerbated with dementia. There's that loss of control. You have a hard time trusting other people around. Who can you share your diagnosis with? And there's that feeling of loss of respect as well. So that's why, as a caregiver and as a professional, it's really important to offer that respect to a veteran. Dementia represents the perceptual loss of control, which I just talked about. And one of the other unique challenges is that when it comes to a veteran needing long-term care, as far as nursing home care, skilled nursing facility, veterans who need to be at least 70% service connected in order to receive those paid services. And we'll talk about what service connection is and what that means a little bit later, but that is a unique challenge to veterans. When I do care coordination, quite often a veteran may not be service connected. And once we start talking about resources, they think that well, the VA is going to take care of me. They're going to provide a place for me. And then we have to have that conversation about service connection and how the VA doesn't necessarily pay for those skilled nursing costs. And then we have to develop other plans in place. So that can definitely be a unique challenge. Early detection matters. The benefits are understanding symptoms, accessing better treatment options, and making better, well-informed decisions. That's what we're going to talk about next. So understanding symptoms, primarily what we do once a veteran first starts having some concerns about memory issues is we try to have a conversation about what's normal and what's a cognitive impairment. And so this is kind of just a quick screen that we use. We ask them, if you make a bad decision, is it every once in a while or is it more frequent? Are you missing payments occasionally, regular payments, or is there a problem with taking care of your monthly bills? Are you forgetting which day it is and remembering it later, or are you losing track of the date and time, maybe even the year? Are you sometimes forgetting which word to use, or are you having trouble carrying on a conversation? Are you losing things from time to time, or are you misplacing things often and not able to retrace your steps to find them? So I know that some of the earlier presentations talked about this. Normal aging. Sometimes people are relieved to find that, what they're going through maybe a bit more normal. There's still benefits that we can offer to increase memory. But if it does present as more of a cognitive impairment, then we can start doing some other assessments to find out what's really going on. Then there's the 10 warning signs of Alzheimer's. So for those who have the cognitive impairments, is there memory loss that disrupts life? Is there challenges in the planning or solving of problems? Is there difficulty completing familiar tasks? Confusion with time or place? Trouble understanding visual images or spatial relationships? New problems with words and speaking and writing? Misplacing things and not able to retrace your steps? Decreased or poor judgment, withdrawal from work or social activities, or changes in mood or personality. So these are the big things that we're really looking for. Conditions that have cognitive impairment symptoms but are other medical conditions in disguise, and are reversible. So chronic alcohol use is one of those things that can mimic dementia symptoms. Interestingly enough, when I was looking at this, excessive alcohol use, but actually stopping complete alcohol use can also show some of those symptoms. So not completely stopping alcohol use completely, but reducing it down significantly has shown to be more beneficial. Cancers and tumors can mimic those symptoms. Delirium for different reasons, whether it's medication or whether it's a mental health concern. Depression, urinary tract infections, hearing or eyesight problems, medication interactions, sleeping problems, head trauma, normal pressure hydrocephalus, and that's when there is a fluid buildup on the brain. This can happen for different reasons, but when it does, it can definitely mimic signs of dementia. Sometimes it's treated by putting a shunt in, which drains that fluid from the brain, and people can get better from that. There can be various diseases that mimic it, and also a vitamin B12 deficiency can present as dementia symptoms. So our team here at the VA, from a medical perspective, these are all the different things that they look at, and they rule these things out to determine whether there's dementia or not. So now let's talk about the diagnosing process. Talking with your doctor about symptoms and concerns, that's definitely the first step. You may be asked to complete a cognitive measure and family history assessment as part of the initial workup. And that's one of the things that I do primarily in my job. If they confide with their care team that they're having some memory issues, a consult comes to me, a referral comes to me, and then I meet with them and I talk about what's the difference between normal aging or cognitive impairment. I may do a cognitive measure, Montreal Cognitive Assessment, a MOCA, and talk about their family history as part of that initial workup. Back with their care team, they may have a physical exam, blood work, possible other tests to rule out medical reasons or symptoms. They may also be asked to see a neurologist or neuropsychologist. These are specialty services. Sometimes the primary care can't make that determination because maybe it's a little bit more complex than they can handle. So they may refer you to a neurologist or neuropsychologist for further testing. And if you are diagnosed with a neurocognitive disorder, you would be referred to someone like me, the dementia specialists, who can help coordinate services. So there are different treatment options. These are the medication therapies that kind of I took from the Alzheimer's website, a presentation that was offered by one of their staff, which is a really good resource. Aricept, Exelon, Residine. I'm actually not going to pronounce some of these because I'm really terrible at names of medications, but they treat anything from mild, moderate to severe dementia. Sometimes they're held in combinations to treat different levels of dementia. So no matter what stage you're in, there may be some medications that can be helpful. This is up to the doctors to determine what medication plan might work best. But as you notice, also, a lot of these medications help with mild to moderate levels. So that's why early detection is so important. Non-pharmaceutical treatment options. There's cognitive coaching. So this is a program that we offer from our speech and language pathologists. Cognitive coaching works with veterans on an individual level to look at their cognitive ways of thinking and provide some techniques which can be much more helpful. So this would be appropriate for someone who has maybe some memory concerns, or maybe starting to have some cognitive impairments, or even mild levels of dementia. That cognitive coaching program can work really well. We do have a group in Whole Health called Executive Skills Group. Veterans can meet as a group to talk about different techniques that can help, different skills. Improving physical movements can be done through our physical and occupational therapy staff. As mentioned earlier, the senses are very important to preventing dementia or treating the symptoms. So having your hearing treated through our audiology department or having your vision corrected through ophthalmology is very important as well. We have a behavioral health team, so veterans can access mental health counseling for depression or just adjustment to a diagnosis. That can be very important. We also have spiritual counseling through our VA staff, our VA chaplain. We also can recommend lifestyle changes, which I know is what Alzheimer's Association and a lot of other people have really found to be effective. There's so much research that shows this. Taking care of your vascular health, that's one of the first things to really do. A person who has high blood pressure puts them at higher risk for stroke, which can then put them at higher risk for vascular dementia. So taking care of that vascular health is very important, and that's one of the first things that we usually talk about. Switching to a Mediterranean or brain healthy diet. I believe the DASH diet is one of those as well. So we have nutritionists that veterans can meet with to talk about what that is and how they may change their diet to something that's a bit more brain healthy. Staying active physically, mentally, and I usually include the socially as well. Those are the three most important things for anyone who has cognitive issues. I tell them to stay active, both physically, mentally, and socially. Engaging socially, whether it's family or whether it's with friends, that's very important. But with that, and I may bring that up a little bit later, it's important to also recognize what's the level of feeling sociable for that veteran. Sometimes because of some of the traumas they've been through, going out and being social in a large setting is not for them. That just creates a whole new level of anxiety. So for some of them, it's just being around family. and that can be very important. But it also is important for the caregiver to know and understand that, to take that veteran's perspective into consideration with what is socially acceptable for them. Prioritizing the quality and quantity of your sleep. Having worked in the field of sleep, I know the effects that sleep apnea can have. Sleep apnea, if not treated, can cause lower oxygen levels, which can then cause heart issues. You can start to develop atrial fib, which can lead to diabetes and strokes, which once again affects the vascular system. So getting your sleep treated if the quality is off, if you're not sleeping well at night, have a conversation with your doctor about that. If you're not getting a good quantity of sleep, that's also something to talk about. Average person, average younger adult typically gets 7 to 8 hours of sleep per night. As we get older, that can go down. Typically, I typically see 6 to 7 hours for most older individuals. That can be a good quantity of sleep. But for someone who's suffering from insomnia, where they say I'm only sleeping 3 or 4 hours a night, that's something to have a conversation about. Limit the amount of alcohol you use and stop smoking if you are. These things can cause significant issues. Rethink your home, remove clutter and limit noises. We just had a really great presenter who talked about this. Rethink how your home is laid out. Remove any clutter, limit noises that are around, keep things out of the way, use aids that can help prevent falls. Making well-informed decisions. With early detection, veterans can access timely interventions that can significantly slow the declining process of dementia. That's one of the most important things of early detection. You got to know what's going on in order to be able to access resources and treatments that can be helpful. Knowing that dementia will eventually progress, important financial decisions can be made that will benefit the veteran and family in the long run. It's very difficult when I meet with a veteran who has not acknowledged any of these concerns, and now they're coming to me with more of a moderate to a severe level of dementia, and they haven't planned for the financial piece, and now they're struggling to find out what to do as a family. So early detection really leads to being able to have those financial discussions early on. Receiving a diagnosis of dementia in its early stages means that you can choose what matters most to you. I have a slide on age-friendly treatment. One of the key pieces there is what matters to you most. Anyone who has dementia, they can start to lose track of that. All they may see is the dementia in that moment. So it's good to be reminded what matters to you most now. Let's work on that. Let's focus on that. Let's provide the best care to get what matters to you now. Let's make that part of your goal. Dementia can be difficult to go through alone. Early detection allows you to connect with others who may have similar experiences and develop a good social support system. There's a lot of early interventions, social programs that can be out there. It's good to have someone other than family to talk to about some of the things that you're going through, and that's especially true for veterans. Veterans like talking with other veterans, so having a support group where they can talk about what they're going through and what it means and what's common, that's very important. And there are resources that especially benefit those with mild to moderate levels of dementia. So early detection gives them access to those resources. Next, we're going to talk about the need for care coordination, developing a support system, identifying and assessing resources, and planning for the best quality of life. That's the what matters. So the importance of a social support system. A dementia diagnosis really causes most people, not just veterans, to isolate. This can lead to further depression, lack of motivation to provide self-care. These are the things that can start a downward spiral that we really want to avoid. So it's very important to have a social support system in place that the veteran can use. Social supports allow veterans to communicate their thoughts and emotions to people other than their significant others and families. As we talked about, veterans like talking with other veterans. So finding those avenues where they can share emotions that otherwise they would be hiding from their family can be very beneficial and very important. Social supports can help encourage a healthy outlook and increase the quality of life. So it can help change your perspective. If you're looking at a dementia diagnosis as, I'm going through this and no one else understands this, and I don't know what I'm going to do about it, that's a negative perspective that can be common. But when you start hanging around other people and you see what they're doing, it can change your outlook. It can really help you to get out of your head and start seeing life in a mindful way. Mindfulness is one of the things I really encourage my veterans to do. Be mindful in the moment. Don't think about the past. Don't get too far into the future. Think about what you have now, limit that time frame, and really focus on the perspective of what you have here and now. Perceived social support is closely linked with healthy outcomes. Research shows this. However, what a veteran views as social support can differ based on their own experiences. And this is what I was alluding to a little bit earlier. Caregivers kind of just need to be cautioned about assuming a certain level of social interaction with a veteran. If a veteran has PTSD, they are not going to want to go out to parties or to events. They may just want to hang out with family. They may have a small group of friends that they like being with. It is still important to attend those social activities and participate in those, but it needs to be something that the veteran is comfortable with. The importance of a professional support system. Dementia often brings with it comorbid health concerns. So treating each health issue is important, and this is where a team of professionals can really help. They collaborate with each other. They look at the health issues that are impacting a veteran, and they can work together as a team to do that. The Veterans Administration has developed a dementia system of care, which outlines the use of an interdisciplinary team approach to treat all aspects of the veteran. And a dementia care coordinator, which is what I do, provides care collaboration support. And I work closely with that interdisciplinary team to make sure that that's working as it should. Identifying and accessing resources. Each veteran with dementia has their own specific care needs and person-centered goals. So identifying and gaining access to the resources that would benefit them most, that's my role. The VA has many programs and resources at the healthcare facility, but sometimes it can be overwhelming, especially if you're starting to have some of those cognitive issues or memory issues. It can be very confusing to talk about all the different resources and not understand what they all are. And this is where I can help. I can help them navigate what those resources are and point to the ones that are most important, first and foremost, help them prioritize. And there are also many community resources designed to help individuals with dementia. So part of my role as care coordinator is to help identify those different resources. Um, a lot of those different resources were here today. So I'm very thankful for those resources that have been talked about, and working with them to provide the best care when perhaps they would be a little bit better to provide that support than what the VA may be able to offer. So planning for the best quality of life, this is the what matters most. Um, the idea of a person-centered care plan is a driving force behind VA's core coordination or care coordination services. Quality of life is defined differently by each person, and this is where that person-centered care really comes into place. For someone, it may be staying at home is the most important thing to me. It may be being active and staying active. For someone, it can be finding a better environment to be in, but it's specific to them. And it's really important for the whole care team to really have the time to take inventory of what that is and to work together in that interdisciplinary approach to help them achieve that from both a health perspective and resource perspective. Another way that the VA Dementia Care Coordinator provides care is by collaborating and supporting with family and caregivers. So I'm very fortunate in my role that not only do I work with the veterans, but I can work closely with the family and the caregivers. And that's been an area that the VA has been historically a little bit shy on. You know, sometimes they help the veteran, but there's really nothing for the family or caregivers. And this is where, in my role, I can meet with the family and the caregivers and sometimes work with them exclusively on the resources that are good for them, how they can coordinate those resources so that they can get them for the veteran. So that's definitely a benefit to my position. So now we're going to talk about two principles that we really like to follow here at the VA. What is age-friendly care? So this refers to the 4 M's, what matters. Ask the veteran what matters most to them and align their care with veteran-specific health outcome goals. Medication. If a veteran needs medication, limit it to age-friendly medications. Don't give them something that's going to interfere with what matters, their mobility or their mental health. Mentation, do whatever you can to identify, prevent, treat dementia, depression, and delirium across all levels of care. Working as a team, we're a little bit better at the VA at recognizing if they're working with one particular aspect of the VA, we can collaborate closely with that person if there is something coming up. For example, if they're on a particular medication, but we're starting to see some more depression, delirium, we can have a conversation more readily with those providers to discuss what that is, and changes that can be made. Mobility, ensuring that the veteran can move safely and every day so that they stay active. Staying active can quite often is what matters most to those veterans. Then there's dementia-friendly care. So with this, it's a comprehensive care and support, which includes screening, assessments, and personalized care plans. We're focused on veterans who have specific things that they want. That person-centered level of care is really at the focus of this as well. We focus on creating dementia-friendly communities that are informed, safe, and respectful. So part of my job as dementia care coordinator is to keep everyone at the VA updated about VA topics. keep them aware, all of those things that make them informed in where they can treat the veteran safely and with respect. Engaging all sectors of the community to provide services and opportunities for those living with dementia. Recognizing that the VA may not provide all the services that a person needs. So reaching out to those other resources in the community that can provide that dementia-friendly care is also very important. Improving language, social support, health services, and physical environments. We have a VA out in Madison, Wisconsin, who came out with this idea initially. They improved their signage at the VA, where they had signs that displayed animals, for example, rather than having, okay, go to building 2 or room 1A. They had a picture of an animal, and it was something that the veteran, especially ones with cognitive impairments or dementia, could more readily grasp the idea of, okay, I want to go to the country farm clinic rather than clinic 2B. So improving the language, putting it in ways that a person with dementia would more readily equate it to that and understand it in a better way. Changing the physical environment so that there are quiet rooms, quiet waiting rooms where a person with dementia doesn't have to sit in a noisy environment while they're waiting for their services. So VA services. Now we're going to talk about specifically the VA services and how to get connected. So service connection, let me talk about that. Service connection, if you're not familiar with military culture, refers to the compensation benefits that a veteran receives when it's been determined that their military time is linked with a current injury or disease that has led them to a disability. And usually it's a ranked system or a tiered system. So a veteran can be service connected for something that may not cause a disability, but they acknowledge it was there, and it may be a 0%. Or if it has minimal effect, maybe it's only 10%. But usually it goes in increments of 10 from 0 to 100%. Most long-term care benefits start at 70%, so that seems to be kind of a magic number for VA benefits. Veterans can apply for service connection at their county's Veteran Service Agency or through different organizations. Most VAs will have a veteran services advocate where they can meet with someone to start that process. There's disabled American veterans that they can connect with to advocate for them as well. There's veteran outreach centers that provide advocates as well. So there can be many different ways that they can start to apply for service connection. And if they have a disability and they've never done that, usually that's one of the things I first encourage them to do. Talk to someone and see if there is a service connection that can be helpful. Service connection is not necessarily needed, though, for access to VA healthcare. Sometimes you can get connected based on your financial level. Sometimes if you served in a particular theater, you can get services. So the most important thing is to contact or enroll with the VA healthcare services through the VA eligibility and enrollment office. And our regional office number is that 585-809-5956. It's going to be included on the resources page at the very last part of this PowerPoint. But that's where it all starts. Getting enrolled in VA care is really the gateway to start getting some of these services. When you are first enrolled, you'll be assigned a PACT team, patient aligned care team. They're kind of like that's very similar to a primary care physician, but it usually consists of a medical provider, which is either a doctor or a nurse practitioner or a PA, an RN, an LPN, and a social worker, and also a clinical pharmacist. They work all together to provide general medical care in the same way that a primary care team would out in the community. But they also can make referrals to medical specialists, like we talked about, neurologists, neuropsychologists, cardiologists, dementia specialists, geriatricians, audiologists, ophthalmologists, speech language. There's a whole slew of different specialties that we have access to at the VA that we can refer them to. So environmental needs can basically be divided into two different types. There's non-institutional care and institutional care. Non-institutional care refers to those services that would help a veteran live safely and independently in their home environment. This includes services such as home health aides, veteran-directed care, which is very similar to CDPAS, adult day health care, medical foster homes, respite, and hospice. Institutional care services are those services that are for veterans who need a safe alternative to live in. So this can be community living centers, which is very similar to the skilled nursing facilities out in the community, or contract nursing homes. VA can provide those services. A dementia care coordinator helps to identify program eligibility and how to access those. Because once again, so a lot of different programs, it can be very overwhelming, especially if you have a new diagnosis of dementia. So it's best to focus on what the veterans' needs are and talk about the programs that are going to help them first and foremost. The Cognitive Care Clinic, that's the program that I run. Essentially, there's two different things that I do. One is to help veterans through the process of getting an accurate diagnosis when they're experiencing cognitive warning signs, but they don't have a diagnosis of dementia or cognitive impairment. So part of my job is to help when something shows up, to help them through the process of figuring out what is it. Work with the interdisciplinary team to figure out and rule out what it might not be and what it really is. The next thing that I do is I provide care coordination services to those veterans who do have a diagnosis of dementia. Once again, there's a lot of different resources. It can be overwhelming. So taking a look at what matters to the veteran most, and then prioritizing the resources, or maybe talking about things that they haven't thought of, or developing alternative plans. That's what the Cognitive Care Clinic would do for them. Once again, it not only provides care to the veteran, but also provides education, support, and assistance to families and caregivers. So these are the screening services. It's just kind of a list of the things that I do, the steps I would take. So I start by doing a chart review, seeing if there is a diagnosis of dementia. I would talk about the diagnosing process, make sure that they're familiar with what that looks like, the different steps. I would identify what matters most to them, what their goals are, help them get connected to the professional care teams that would allow them to figure that out. I would offer education, answer any questions that they have about what is dementia, or maybe they have an immediate need, which I can offer an immediate resource for. And I support them through the diagnosing process. So I would also collaborate with VA professionals. doing things within my scope of practice, but working as part of that interdisciplinary team. If a veteran needs something that I don't do as a social worker, I contact someone who can provide that service within their scope of practice. And once an accurate diagnosis is documented, I help the veteran and family work through it. I educate them about what that means, what the immediate resources might be, and help them get connected to support groups that they may need or even tolerate. And then the last thing that I would do is I would encourage them to participate in care coordination, which is the second part of what I do. Care coordination, much the same process, working from left to right. I review the chart. Now, sometimes people come and they've missed the cognitive care piece, and they've gone straight maybe to the diagnosing piece. One of the interesting things about the VA is that you only need to meet with a PACT team once a year. And sometimes veterans can have physicians out in the community as well. So it's called co-managed care. Sometimes things happen in the community that they may not share with the VA. So by the time they get to talk to the VA, maybe that cognitive issue has turned into a new form of dementia. And so now they're coming to see the VA with more of a dementia diagnosis. So I would look to see if we had that diagnosis accurately noted in their chart. We would talk about immediate needs. We would talk with the family, once again, about what matters and specific care needs for them. We would create a plan. Part of my plan is kind of having recommended first steps. So it helps prioritize what they need to do. And then right below that is the list of the different resources that they need in order to do that. I help the family with ongoing needs. I provide follow-up to them. I can also provide help with transitional care if they need that. And then one of the other most important services that we can offer veterans who have cognitive impairments or dementia is caregiver support services. So this has been in place longer than my programs, so they are much more well developed. Caregiver support program, there's two different program tracks. One is called a program of comprehensive assistance for family caregivers. This would require that the veteran be at least 70% service connected, but it also includes a stipend that can be paid to a family caregiver to provide the care that the veteran needs. So the caregiver is supported through the program, and they're also paid for providing that care. Another program is called the Program of General Caregiver Support Services. So for this one, there doesn't need to be any service connection, but it also doesn't include any financial stipend. The other programs, though, they still have access to. So education, support, these are still things that we can provide to the caregiver. Both programs provide the educational support and resources that can be used by caregivers as they take on the role of caring for the veteran. Some of the services that caregiver support provides is the REACH VA program, which is resources for enhancing all caregivers' health. It's a really nice evidence-based program that they can go through. Caregiver health and well-being coaching, Caregivers First program, SAVE training, which has to do with educating about suicide, building better caregivers. There's an Annie caregiver text program, caregiver educational calls and caregiver support groups, and they can also help with respite care. So there's a lot of different programs that caregiver support can do. And these are those resources that I talked about: VA enrollment and eligibility. That's how you get connected to the VA initially. VA caregiver support line, the veteran crisis line, National Center for Homeless Veterans, My VA 411 is for any main information about the VA. Perhaps a veteran's locating and they want to find out where the process for connecting with a different VA. They can call that number and find out where to connect. VA Health Benefits Hotline, VA Benefits Hotline. Benefits is a little bit different than health benefits. As a veteran, there can be benefits that are not necessarily health related, but they're benefits still. So this would perhaps be where service connection comes into play, maybe accessing the National Cemetery Association, different things like that. And then there's a women veterans hotline. And then there's a vet center call center. The thing to know about vet centers is that usually they're a bit more family friendly. So if a veteran needs some help with family members that maybe they haven't gotten the support with at a normal VA, a vet center can usually help with that. Any questions?
I was here at 8:10.
Hi, Eric. It's Tara. It does look like there is a question in the Q&A function here.
Okay.
I believe that you may have answered part of this. Are supports available for veterans who are the primary caregivers for their spouses? We had a similar question about spouses and children. So maybe you could answer both those questions. Are supports available for veterans who are the primary caregivers? And also, what about children of veterans?
Yeah. So we have had several veterans who have been referred to me in my role who they don't have dementia, but maybe their spouse does, and they're feeling a little overwhelmed as a caregiver. I do meet with them. I do help them provide services. I focus a little bit on what they can do to take care of themselves, but I also provide the resources that they can access to take care of their significant other as well. And really the same goes for family members, children of veterans as well. It can be very confusing what they need to do, how they can provide the best care. So quite often I will meet with them as well. I can meet with them individually, or I can meet with them typically with a veteran to figure that out. What is it that they need? How can we educate them? How can they support the veteran?
Thank you very much. We just have
Yes.
one more question before we wrap up. And that is, are there resources that are available for a veteran's family when it comes to dementia care after the veteran passes away?
So typically if a veteran passes and they were part of the caregiver support program, there's usually a 90-day window where they can still continue to get services. I would continue to be involved as much as I can, as much as my role would allow me to. To be honest, that is a little bit of a limitation that I'm hoping that in my role that we can address that gap. Like I said, there's that 90-day window. If they have caregiver support, those services would continue. Sometimes we can look at the different resources and help a family work through the process after a veteran passes away to sort out the resources and different things that may be there as well. And that is kind of where I see my role.
Wonderful. Thank you for answering that and our other questions. As someone said in the chat, you are certainly a wealth of information. We are so fortunate here in the Finger Lakes area to have you doing this very important work with veterans and caregivers and the families in our community. So thank you for sharing all of that. I know that I learned a lot, and I see a lot of hearts and thumbs up from our audience. They really appreciate having an inside look on this very important work that you're doing through the VA, Arick. So we appreciate you taking the time to be with us today. And just like with our other presenters, if you had a question that we didn't have time to get to today, please feel free to share those with us. And we will make sure that those get to Arick if you're not able to ask them today. So excellent, lots of hearts and lots of thumbs up going for you, Arick. We wish you a really happy Friday evening and hope you have a wonderful rest of your weekend.